Drink this every morning and watch what happens to your prostate. After 50, most men over 50 start their morning the same way. They wake up, usually after a fragmented night. They shuffle to the bathroom, often for the second or third time since midnight. They stand at the toilet waiting for a stream that takes longer to start than it used to and leaves them with the nagging sense that the job was never quite finished. Then they make coffee, drink it quickly, and head into their day carrying a level of fatigue they have long since stopped questioning. This pattern, repeated morning after morning, is not simply the unavoidable texture of aging. It is the downstream consequence of a biological environment inside the prostate that has been shifting in the wrong direction for a long time. And what you consume in the first 30 minutes of your morning has more influence over that environment than most men ever realize. I am Dr. John Carter. I am a urologist. And today I want to have a specific, evidence-grounded conversation about morning beverages and their relationship to prostate health. Not in a vague wellness sense. In a precise biological sense. I'm going to tell you which beverages the research identifies as actively protective for prostate tissue, which are harmful and through exactly what mechanisms, and how to construct a morning drinking routine that begins modifying the hormonal, inflammatory, and vascular environment of your prostate from the very first minutes of your day. This is not about replacing your morning coffee with a green smoothie and calling it health. It is about understanding what specific compounds do in the prostate at the cellular level and making morning choices that put those compounds to work for you. What your prostate needs from your morning routine. By the time you wake up, your prostate has been in relative rest for several hours. Blood glucose is at its lowest overnight level. Cortisol is preparing to peak in the first 30 to 60 minutes after waking. Testosterone, produced primarily during deep sleep, is at its highest morning level. The inflammatory signaling that drives prostatic cell proliferation is at its relatively lowest point of the 24-hour cycle. The morning is a biological fresh start. The question is whether your first hour of choices reinforces that fresh start or immediately begins shifting the prostatic environment back toward the conditions driving its growth. 4 specific conditions in the prostate are most directly influenced by morning beverage choices. The first is systemic inflammation. The inflammatory cytokines that promote prostatic cell proliferation fluctuate throughout the day in response to what you consume. What you drink in the morning sets the baseline inflammatory tone for the next several hours. The second is insulin and IGF-1 signaling. Insulin-like growth factor 1 is among the most potent drivers of prostatic cell proliferation. Its morning level is directly influenced by what you consume immediately after waking, before your metabolism has fully accelerated. The third is androgen metabolism, the balance between testosterone and its more potent derivative dihydrotestosterone, and the ratio of androgens to estrogens in prostatic tissue is influenced by compounds in morning beverages that directly modulate the enzyme activity responsible for their interconversion. The fourth is prostatic blood flow. The pelvic vasculature determines how well the prostate is oxygenated and how effectively it clears inflammatory waste products. Beginning the day with compounds that support vascular health versus compounds that constrict or stress the vasculature makes a measurable difference to prostatic tissue oxygenation throughout the day. Morning beverage 1. Water. First, before everything else. Before coffee, before tea, before anything else, drink a full glass of water, 8 to 12 ounces, room temperature or slightly warm, within 5 minutes of waking. The reason this matters for prostate health specifically is blood viscosity. During the overnight period, insensible fluid losses through respiration and skin occur continuously. By morning, blood is measurably more viscous than it was at the start of the night. More viscous blood moves through the small vessels of the pelvic vasculature with greater resistance. Capillary pressure increases. Fluid leakage into the surrounding prostatic tissue increases. The lymphatic system, responsible for clearing inflammatory proteins from the prostatic interstitium, moves more sluggishly when its fluid is concentrated. Drinking water first restores blood and lymphatic fluid to optimal viscosity, reduces pelvic capillary pressure, and improves the efficiency of inflammatory protein clearance from prostatic tissue. Add a small squeeze of lemon. Lemon contains limonene and hesperidin, compounds with documented anti-inflammatory effects. Its mild acidity supports the activation of digestive enzymes that influence the absorption of nutrients consumed subsequently. This takes 30 seconds. It is the foundation on which every other morning beverage builds. Morning beverage 2. Green tea. The most evidence-supported beverage for prostate health in the clinical literature. If I could recommend one specific beverage change to every man over 50 based solely on the strength of evidence, it would be this. Replace at least one morning beverage with properly brewed green tea. Green tea contains a family of compounds called catechins. The most biologically active is epigallocatechin galat, or EGCG. EGCG has demonstrated direct inhibitory effects on prostatic cell proliferation through multiple distinct mechanisms. The first mechanism is direct inhibition of 5-alpha reductase, the enzyme responsible for converting testosterone to dihydrotestosterone within prostate cells. DHT is the primary hormonal driver of benign prostatic hyperplasia. Pharmaceutical 5-alpha reductase inhibitors like finasteride work through this same enzyme. EGCG produces a milder but measurable inhibition of the same target through a naturally occurring dietary compound. The second mechanism is inhibition of androgen receptor signaling. Even when DHT is present, it must bind to androgen receptors inside prostate cells to produce its proliferative effects. Research has shown that EGCG interferes with androgen receptor activation, reducing the cellular response to DHT independently of DHT levels themselves. The third mechanism is direct anti-inflammatory activity through inhibition of nuclear factor kappa B, the master transcriptional regulator of inflammatory gene expression, decreasing the production of pro-inflammatory cytokines that drive BPH progression. A landmark clinical study published in Cancer Epidemiology, Biomarkers and Prevention found that men who consumed 5 or more cups of green tea per day had a significantly lower risk of advanced prostate cancer compared to men who consumed less than 1 cup. A randomized controlled trial in cancer prevention research found that men with high-grade prostatic intraepithelial neoplasia who supplemented with green tea catechins had a significantly lower rate of progression to prostate cancer after 1 year compared to placebo. These are human clinical trials showing measurable prostate protection from a compound available in every grocery store. How to brew green tea correctly. This matters because catechin yield is highly sensitive to temperature. Use water at 70 to 80 degrees Celsius, not boiling. Boiling water degrades EGCG significantly. If using a kettle, allow it to cool 3 to 4 minutes before adding tea. Steep for 2 to 3 minutes. Do not add milk. Casein proteins bind to catechins and reduce their bioavailability substantially. Lemon is compatible and may enhance absorption. 1 to 2 cups of properly brewed green tea in the morning. The caffeine content is lower than coffee and is released alongside L-theanine, producing calm, focused alertness rather than the jittery spike and crash of coffee. Morning beverage 3, pomegranate juice, the most potent single beverage for prostatic anti-inflammatory signaling. Pomegranate contains a class of polyphenols called punicalagins, metabolized in the gut to produce compounds called urolithins with specific biological activity in prostate tissue. A landmark study from UCLA examined men with rising PSA levels following prostate cancer treatment and found that daily pomegranate juice consumption extended median PSA doubling time from 15 months to 54 months. While this studied men with treated prostate cancer, the mechanism, suppression of prostatic inflammatory and proliferative signaling, is directly relevant to BPH biology. The anti-inflammatory mechanism is well characterized. Pomegranate polyphenols inhibit cyclooxygenase 2 in prostatic tissue specifically. reduce the production of interleukin-6 and interleukin-8 directly implicated in BPH-associated prostatic inflammation, and demonstrate anti-angiogenic effects that reduce the formation of new blood vessels that growing prostatic tissue requires. 4 ounces of pure pomegranate juice in the morning provides the relevant dose. Read the label carefully. Look for no added sugar products with pomegranate as the sole ingredient. The juice should be dark, deeply red, and intensely flavored. Pale or mild products have had their polyphenol content diluted. Morning beverage 4. Coffee. The complicated truth. Coffee has a nuanced relationship with prostate health that is worth understanding precisely rather than accepting simple recommendations about. Coffee contains 2 categories of compounds with opposing effects. Diterpene compounds cafestol and kawal promote inflammatory signaling and are found in highest concentrations in unfiltered preparations like French press and espresso. These are substantially removed by paper filtration. Polyphenols, specifically chlorogenic acids, are potent antioxidants that reduce systemic inflammation, improve insulin sensitivity, and protect prostatic epithelial cells from oxidative damage. The net biological effect depends significantly on preparation method and timing. The health professionals' follow-up study found that men who consumed 6 or more cups of coffee per day had a 41% lower risk of lethal prostate cancer compared to non-drinkers. The association was seen with both caffeinated and decaffeinated coffee, confirming that protective effects come from polyphenols rather than caffeine alone. The association was strongest for filtered coffee. However, timing matters critically. Drinking coffee immediately upon waking blunts the cortisol awakening response through caffeine-mediated cortisol receptor interference. This matters for prostate health because the cortisol awakening response, when allowed to complete naturally, produces a brief anti-inflammatory cortisol surge that helps regulate the overnight accumulation of pro-inflammatory cytokines in prostatic tissue. Suppressing this response with immediate caffeine eliminates a free morning anti-inflammatory mechanism. Delay your first coffee until 90 minutes after waking. Drink filtered coffee. Black or with minimal plant-based milk. No added sugar. Limit to 2 to 3 cups total. Morning beverage 5. Tomato juice. The lycopene delivery vehicle most men ignore. Tomatoes are the richest dietary source of lycopene, a carotenoid antioxidant with one of the most robust evidence bases for prostate-specific protective effects of any dietary compound. Lycopene accumulates in prostate tissue at higher concentrations than any other tissue in the body, suggesting a specific biological affinity for the prostatic environment. A meta-analysis of 21 prospective cohort studies found that higher lycopene intake was associated with a 25% reduction in prostate cancer risk. The Harvard School of Public Health found that men who consumed tomato products 10 or more times per week had a 45% lower risk of prostate cancer compared to men who consumed fewer than 1.5 servings per week. The mechanisms are multiple. Lycopene directly inhibits cell cycle progression in prostatic epithelial cells. It reduces IGF-1-mediated signaling in prostate cells. It is a potent antioxidant in the specific oxidative environment of the prostate where reactive oxygen species can directly damage DNA. And it has anti-inflammatory effects through multiple signaling pathways relevant to BPH progression. Critically, lycopene bioavailability from tomatoes is dramatically enhanced by heat processing. Cooked tomatoes, including tomato juice and tomato paste, provide significantly more bioavailable lycopene than raw tomatoes. 4 ounces of low-sodium tomato juice in the morning provides a concentrated, highly bioavailable lycopene dose. Look for no added salt or low-sodium products with sodium below 100 milligrams per serving. Add a small pinch of black pepper and a 1/4 teaspoon of olive oil. Lycopene is fat-soluble and absorbed significantly more efficiently in the presence of dietary fat. Morning beverage 6. The turmeric, ginger, and black pepper blend. This preparation is a deliberate delivery vehicle for 3 of the most potent dietary anti-inflammatory compounds available, consumed in liquid form to maximize absorption. Turmeric contains curcumin, which inhibits nuclear factor kappa B, the same master inflammatory transcription factor that EGCG in green tea also targets. The critical limitation of curcumin is poor bioavailability. Less than 1% of orally consumed curcumin reaches systemic circulation without absorption enhancers. Black pepper contains piperine, which inhibits the metabolic enzymes responsible for curcumin clearance and increases curcumin bioavailability by up to 2,000%. This transforms curcumin from a compound that does essentially nothing in the body to one that reaches meaningful concentrations in prostatic tissue. Ginger contains gingerols and shogiols with independent anti-inflammatory effects through cyclooxygenase 2 inhibition, the same mechanism as pharmaceutical anti-inflammatory drugs. Ginger also reduces the nausea some men experience consuming turmeric on an empty stomach. The preparation: combine 1/4 teaspoon of turmeric powder, a small pinch of black pepper, and 1/4 teaspoon of ginger in 8 ounces of warm water. Add a squeeze of lemon and a 1/4 teaspoon of olive oil to enhance fat-soluble curcumin absorption. Consume alongside your morning meal rather than immediately before coffee, as coffee alkaloids can interfere with curcumin absorption. The taste is not pleasant in the way coffee or juice is pleasant. It is medicine in beverage form. But the combination simultaneously inhibits 2 of the 3 most important inflammatory pathways driving prostatic growth and provides powerful antioxidant protection to prostatic DNA. The beverages to remove from your morning: sugary beverages of any kind, commercial orange juice, flavored coffees, sweetened teas, commercial smoothies with added sugars. Any beverage producing a rapid glucose rise creates the insulin and IGF-1 surge that is the most potent dietary driver of prostatic cell proliferation. A glass of commercial orange juice produces a blood glucose and insulin response comparable to a sugary soft drink. If you drink orange juice, limit to 4 ounces and consume alongside protein. Energy drinks: the combination of high caffeine, high sugar, and artificial stimulants produces a simultaneous glucose spike driving IGF-1 elevation, cortisol elevation from adrenal stimulation, maintained sympathetic nervous system tone, and reduced pelvic blood flow from vasoconstrictive high caffeine. These products have no place in the morning routine of any man concerned about his prostate. Full-fat dairy in large quantities. High intake of full-fat dairy has been associated in multiple large cohort studies with elevated prostate cancer risk through mechanisms involving the high concentration of IGF-1 in dairy and the high calcium content that may suppress vitamin D activation. Vitamin D deficiency is associated with more aggressive prostate cancer behavior. Modest amounts of low-fat dairy are unlikely to produce these effects. Your complete morning beverage sequence: immediately upon waking, 8 to 12 ounces of water with a squeeze of lemon, 30 seconds. Non-negotiable: within 15 minutes, 4 ounces of low-sodium tomato juice with a pinch of black pepper and a 1/4 teaspoon of olive oil. Alongside or following your morning meal, 1 to 2 cups of properly brewed green tea at 70 to 80 degree water temperature. Also, alongside your morning meal, the turmeric, ginger, black pepper, lemon warm water preparation with a small amount of fat. 90 minutes after waking, your filtered coffee, black or with minimal plant-based milk. No sugar, 1 to 2 cups, 2 to 3 times per week. 4 ounces of pure pomegranate juice on days you vary from the tomato juice. What to expect? In the first 1 to 2 weeks, the most noticeable change is morning energy and mental clarity. The graduated caffeine approach, water and green tea before coffee, produces a more sustained morning energy profile. Morning urgency often begins to reduce slightly from improved hydration and reduced bladder-irritating compounds. In weeks 2 through 4, men who have been consuming inflammatory-promoting beverages consistently notice measurable reductions in daytime urinary frequency as systemic inflammatory tone modulates downward. Between 1 and 3 months, the anti-inflammatory and anti-proliferative compounds delivered through this morning routine begin producing measurable changes in the biological environment of the prostate. PSA measurements, when monitored, sometimes begin reflecting reduced proliferative pressure. After 3 to 6 months combined with the evening protocol and movement habits from previous conversations, men frequently report improvements in urinary flow, reduced nocturia, diminished urgency, and a quality of energy that reflects cumulative improvement in sleep, hormonal balance, and systemic inflammation. When medical evaluation is necessary. Morning beverage changes modify the underlying biological drivers of prostate disease. They are not a substitute for medical evaluation or physician-directed management. If you have a rising PSA, rapidly worsening symptoms, blood in the urine, or acute urinary retention, seek medical evaluation regardless of what you are drinking in the morning. Annual PSA testing and prostate examination after 50 are non-negotiable and non-replaceable by any dietary protocol. Your morning starting tomorrow. Wake up. Water with lemon immediately. Tomato juice shortly after. Green tea with your meal. Turmeric ginger blend with your meal. Coffee 90 minutes after waking. Pomegranate juice 2 to 3 times per week. Remove sweet beverages, energy drinks, and excessive dairy. This sequence requires no additional time beyond your current morning routine. It simply redirects the same morning ritual toward compounds with documented, evidence-based, specific activity in the biological environment of your prostate. The man who makes these changes consistently over 6 months will have delivered thousands of doses of the most evidence-supported dietary compounds for prostate health to the tissue that needs them most, through the biological window when those tissues are most receptive. Nobody in a clinical appointment had time to explain this to you. Now you have it. This is Dr. John Carter. Begin tomorrow morning. Your prostate has been waiting for this. I will see you in the next one.